Madeline Mumbert. My student ID number is 3251089. My semester is the spring of 2020, and my course is Veterinary Nursing Care, course number 2439. To start my video, I'll be demonstrating a heart and lung auscultation on a dog. This is my patient, her name is Maya. To do this, I'll start with my stethoscope with the earbuds facing away from me. I'm going to listen right behind the armpit, or the axilla, and I'm going to start by taking a heart rate. So that was 15 beats in 10 seconds. So if you multiply that by 6, you get a heart rate of 90 BPM or 90 beats per minute. And I'll listen to the other side. You can also take that number and multiply it by 4. That would also give you your BPM, or the number you get in a 15-second interval. You can multiply that by 4. I'm listening for any swishes, which could indicate a heart murmur. I was also listening for the intervals in between the beats. They should be equal. If the intervals are not equal, that could indicate an arrhythmia. The last thing I'm going to do is take a listen and also feel the femoral pulse and make sure that they are the same. You don't want your femoral pulse to feel thready. You want it to feel strong and synchronous with the heart rate. Okay. So that all sounds good. Now I will take a listen to the lungs. So I'm going to do the same thing, count the number of breaths in a 10-second interval, and that will be my respiratory rate. So just took only 5 breaths in that time, so multiply that by 6, that's a respiratory rate of 30. Again, you can also count the breaths in a 15-second time period and multiply that by 4. That would also give you a respiratory rate. I'm going to continue to listen. I'm going to listen to all 9 quadrants of the lungs. Listening for any abnormalities. If I hear any wheezing, that could indicate asthma. I would want to notify my veterinarian. Take a listen to the other side. If I hear any crackling sounds, that could indicate fluid in or around the lungs or pleural effusion. I would also want to tell my doctor about that. Okay, and the last thing I'll do is I'll listen to the trachea. To listen for any abnormalities in the upper airway, or the upper respiratory tract. And that all sounds good. And that's it. Hi, this is Madeline. Today I will be demonstrating how to use a rabies restraint pole. To do this, I have my patient here. His name is Paxton. He is not an aggressive dog. He's very friendly. But we would use the rabies pole in the event that we had an aggressive dog or a dog that we needed to keep distance from while we were examining or treating. This is the rabies pole that we have here at the clinic. It locks in position when you turn it. So I'll keep the noose kind of open just to slide it over his head. I'll unlock it by turning it, and that tightens it. To loosen it, I'll just pull backwards, lock it, and that way I can remove it. Hi, this is Madeline. Today I will be demonstrating how to clean a kennel. To do this, I'll be using Kennel Sol. It also goes by the name Parvasol. It is a germicide that works as a detergent and a deodorant. We've diluted it into this bottle, and so this is what I'll use to clean our kennel. To do this, I'll spray all sides of the kennel, including the top, the bottom, the 3 sides, and the door on the outside and the inside. And the contact time for this particular solution is 10 minutes, so I'm going to set my timer over here, and we'll return to it after the timer goes off. Okay, so it's been 10 minutes, so I'm going to go back to my kennel, and it's dried a little bit, so I'm going to go ahead and spray one more time to loosen everything up a little bit so it's easier to wipe off. And then I will wipe everything down. You start at the top of the kennel. And then you move on to each side. And then the back of the kennel. Make sure I wipe every corner. And then the bottom last. And the reason you do that is you want the part of the kennel that has the most contact with the animal to be last, so you're not spreading anything. So that would be the bottom. And then you do the door. Make sure to get the horizontal and the vertical bars. And then we'll do the outside and do the same thing. My name is Madeline. Today I will be demonstrating an anal gland expression on a dog. This is our patient. His name is Patches. To do this, the supplies that I need are a pair of gloves, some lubrication, and then baby wipes to clean up afterwards. But when I do this, I'm going to put a small amount of lubrication on my index finger and my dominant hand. And then when you're visualizing what you're going to do, comparatively to the anus, the anal glands sit at a 4 and an 8 o'clock position, respectively, so that's where I'm going to want to palpate. And so I'm going to go into the anus up to just the first digit of my index finger. I'm going to keep my thumb on the outside, and that way I can hook my index finger but massage with my thumb to express the gland. So we're going to go in.
That first one on the
Sorry, Patches. I'm using firm but gentle pressure to express, and we do the other side. Okay. And this is the debris that came out of the anal glands. So a little gritty, dark brown color. This is considered normal. You don't want anything to be yellow or green, or have a particularly foul odor to it. Anal glands are going to smell bad, but if it's really, really bad, then that can indicate infection. If there's blood also, then you'd want to notify your veterinarian. And that's it. Hi, this is Madeline. Today we will be demonstrating how to apply a topical ointment. In this case, we'll be applying Revolution Plus to our cat. This is Chloe. She lives at the clinic. She's on a weight loss program. But this is our preventative, so Revolution requires that you plunge the tip down and then twist it off so that it can break open, and then you can apply. we're gonna part the hair before we apply it to make sure it makes contact with the skin, and we're gonna apply it up near the base of her head actually. If you apply it too low down on the neck, then they can reach it, and if they lick it, then they can hypersalivate, and it makes them uncomfortable. So we're gonna part the hair. We're gonna squeeze the contents of the entire tube on, and that's it. Hi, this is Madeline. Today we will be demonstrating an ear cleaning on a dog. This is Bailey. We'll be cleaning and treating her right ear today. I have my Odic ear cleaner, and there are two methods of cleaning ears. If they were really dirty, you can just take the cleaner and apply it directly into the ear canal, massage it, and then remove the debris. But her ears are not that dirty today, so we're going to put the cleaner onto some gauze pads and clean her ears that way. So I'm going to lift the pinna upwards so I can see into her ear canal and just gently wipe and pull some of that debris out. And then I can also go in with some Q-tips doused in the cleaner to get into the crevices and deeper into the ear canal. And just go until you don't get anything else on your Q-tips. So pretty clean. And then once your ear is clean, you'll apply your medication. This is a tube of Claro ear ointment. So we're gonna spike that open. Put the applicator tip on, lift the pinna up again, and we're gonna insert the tube directly down into the ear canal and squeeze. And then massage that in, and that's it. Okay, today we'll be demonstrating an ear cleaning on a cat. There are two different methods of doing this. The first is if they are really dirty, you can take your ear cleaner, I have Odic cleaner here, and you can apply a couple drops straight into the ear. But her ears are not that bad, so we're going to put the cleaner on some gauze. And we're gonna wipe the inside of her ears. Try and pull some of that out. Not very much. And then to get into the crevices, we're gonna put some cleaner on some Q-tips. You don't have to worry about hitting their eardrum necessarily, but you still want to be gentle. Okay. Didn't really get much debris out at all, so we'll put our medication in now. This is Claro. This is going to go straight down into the ear, so I'll hold the pinna up. Oops. Hold the pinna up, and then apply that. Just kind of gently massage it in. And that's it. Hi, my name is Madeline. Today we'll be demonstrating a nail trim on a dog. This is our patient. I will be demonstrating how to use our nail clippers and Dremel. If you want to come in a little closer. So we'll be tipping the nails. On these ones we're lucky because you can visualize the quick, so I'm going to cut up here. But you don't want to cut into this because this is the supply for blood and nerves for the nails. If you cut into that, it's going to bleed and it's going to hurt. So we're going to just tip each nail. Don't forget your dew claw. And then I'm going to go in with the Dremel, and we're going to round these nails out so they're not super sharp. And if I did cut into the quick on accident for one of these nails, we have our styptic powder or quick stop powder, and I can put a little bit on my finger and apply it to the nail, or I can dump a small amount into the lid and press the whole nail bed in, and this will stop bleeding. And that's it. Hi, this is Madeline. Today I will be demonstrating a nail trim on a feline patient. This is our cat. His name is Sushi. We'll be using nail clippers, and then we also have our styptic powder here in case we click a nail. But if you want to come in closer, for cats, you want to lightly put pressure on the digit to expose the nail. And then you can visualize the quick, which is the pink part. So we're just gonna take a tiny bit off the nail and just tip it. Okay, and then if I were to cut into the quick, it would start bleeding because it's the supply for blood and nerves of the nail. I would take a little bit of our styptic powder called Quick Stop and apply it straight to the nail to stop bleeding. Hi, this is Madeline. Today I will be demonstrating how to pill a dog. To do this, I have my patient here. His name is Paxton. I'll be using a little ball of pill wrap to pill him, and then I also have a syringe with some water to chase it afterwards. When I do this, I'll ask my patient to sit, and then I will use my non-dominant hand to hold his face, and I'll use my dominant hand, my right hand, to pill him. Paxton, sit. The non-dominant hand, I'm going to tilt his head up, open his mouth, stick it as far back as I can, follow it with some water, and I'll keep his head tilted up until I see him licking, which means he's swallowed, and that's it. Hi, this is Madeline. Today I will be demonstrating how to pill a cat. This is our patient. His name is Sushi. To do this, I have a small ball of pill wrap to act as my pill, and then I pulled up some water in a 1 cc syringe to flush it down. To do this, I have my assistant restraining, and then I'll have control of the head. So I'll use my non-dominant hand to grab his face and my dominant hand to pill him. I want to grab right behind his cheekbones or his zygomatic arch and pull his head up. I'll use my thumb finger to lower his jaw, and then put it back as far as I can in his throat. Follow it up with some water. And when he licks, you know that he's swallowed. And that's it.